So good afternoon. This afternoon we're going to visit with our second in a series of Meet Our Physicians of the Hellenic Medical Society of Philadelphia with Dr. Theos Aoutis, who is Associate Chief of the Division of Infectious Disease in Pediatrics at the University of Pennsylvania, and he is also a Professor of Pediatrics at the Children's Hospital of Pennsylvania. So good afternoon, Dr. Aoutis.
Good afternoon, Dennis.
Okay. So let me ask you, why are you a member of the Hellenic Medical Society of Philadelphia?
So I think we Greeks value community, and I think it's one of the main I think attributes of our culture is to be part of a community. And I think the Hellenic Medical Society provides the scientists and physicians in the local Philadelphia area a community of sorts. Since we can't be in Greece full time, I think this is the second best thing.
Excellent. And let me ask you, how did you become a pediatric infectious disease specialist?
So that's a very good question because it's complicated. The answer is complicated. After I graduated college, I didn't know exactly what I was going to do. I graduated college with a degree in biology. And this is to all the people out there who haven't figured out what to do after biology. It could turn out well regardless. So I moved around for 6 years, worked in a laboratory for a couple of years, worked for a pharmaceutical company for a couple of years, went to graduate school for a couple of years, and then I decided that I was going to pursue medicine. And it was clear to me very early on from my clinical rotations in medical school that I truly enjoyed pediatrics. And the next decision point for me was whether I was going to go to a more cognitive specialty or a more surgical specialty, and I absolutely adored infectious diseases, and I had terrific mentors that were influential in making me go into infectious diseases.
So what do you do right now?
So I spend about 20% of my work time seeing patients in the hospital. I'm a consultant on the infectious disease consultation service. Well, my area of specialty is actually patients whose immune systems don't work well, immunocompromised patients, mostly children with cancer or transplants. On the research side, I'm very interested in antibiotics and antibiotic resistance. The CDC, the WHO, both have recognized antibiotic resistance as one of the world's greatest global threats. And it's a growing problem that we need to address. So in our research group, we're trying to figure out both how to better use antibiotics so that bacteria do not become resistant, plus also figure out on the bacteria part what we can do to help them or prevent them from becoming resistant.
So can you tell us a little bit about what you can do to prevent the resistance?
So I think what we can do as a community, both as a medical community, but even beyond just the medical community, is to be more judicial about how we use antibiotics. It is known from the literature that 50% of antibiotics are used inappropriately. So 1 in 2 prescriptions, it probably is not necessary. So I think we need to be a little more careful when we prescribe antibiotics. Most of the common conditions for which we prescribe antibiotics are viral. The common cold, sinus infections, most of these start off as viral infections and do not require antibiotics for the patient to get better. So I think we need to be better, what I call stewards of antibiotics, and use them more effectively.
And how about, ways to prevent spread of resistant bacteria and other organisms from person to person in the hospital? This has taken a lot of press lately.
Yeah, so hospital-acquired infections have become a major problem and have, like you said, Dennis, received a lot of press. And people always laugh when I answer this question because I answer it a lot. And I say, hand hygiene, washing your hands. We could do all sorts of fancy things. We could utilize technology, but the truth is the most effective and the cheapest way to prevent these infections is to wash our hands appropriately.
Okay. I understand that you have a program where you are teaching people in Greece to have a better infection control measures. Can you tell us a little more about that?
Sure. It's actually my passion at this moment is my work in Greece. Several years ago, I felt a calling to help Greece. It was the time of the peak crisis, the time of peak crisis in Greece, and I wanted to do something. I felt that I needed to contribute. It was my calling. And Greece has a major problem, both in terms of healthcare-acquired infections. So they have one of the highest rates in the developed world. And they also have the highest rate of antibiotic consumption in Europe and the United States. And they have the highest rate of antibiotic resistance. So they have all three sort of working against the healthcare system, especially people hospitalized in the patients hospitalized in Greek hospitals. So I've been involved with a project there that's funded by the Stavros Niarchos Foundation to try to improve infection control efforts in the hospital. We've started out with work at the Children's Hospital in Athens, Nosocomio Pedon, and are trying to both develop ways for them to count the infections, so adequate surveillance, and then teaching them best practices, and then showing them their own data so that they can actually try to improve on their performance. Things that we've been doing here in this country in terms of quality improvement for the last 5 to 10 years, we're trying to bring to the hospitals there. The hospital-acquired infections in Greece cost Greece $1.3 billion euros annually. So we can eliminate a significant chunk of the fiscal burden by reducing these infections.
Thank you. What do you like to do outside of medicine, outside of work?
So I like to visit my village in Greece. I am from Ikaria, the land where people forget to die, as the New York Times has coined it. So I made an annual pilgrimage there to the island. I like to hike, I like to swim, I like to fish when I'm there. When I'm here in the States, I'm very involved with my boys' sports. My twins are 15 years old, and they're very avid soccer players, and I push them to do that as a Greek and a lover of the sport, and I'm active in their playing soccer.
Okay. Thank you very much. And what we didn't say before, Christos Anesti?
Alithos Anesti.
Okay. Thank you. Goodbye.